yield for a question.
I will yield specifically for the question, yes.
Thank you. I first want to thank my colleague for taking the floor, to showing the American people how horribly this administration is treating average families, working families in so many ways. And I know he intends to hold the floor for a long time to make sure that's the case, letting America know how bad this is. On health care has been the focus right now. And it's amazing, I would say to my colleague, isn't it incredible? All these cuts they're proposing in health care are done with a purpose in mind, and that is to reduce the taxes on billionaires. And doesn't it bother my colleague that these people who he's been documenting, who so desperately need health care, are going to lose that if our Republican colleagues have their way, simply to cut taxes for the very wealthy? It's my question.
To my Leader Schumer, I mean, that's the pain in these stories. The families that I read, the fear that they have, that they're relying on these lifelines that are going to be cut, services that are going to be cut, that are going to affect their beloved parents or their children with disabilities. When they ask the question, why? Is it for a noble purpose? Is it for collective sacrifice? No, the answer that they have to stare at is that you're going to cut services for my vulnerable child or my parents in order to give tax cuts to the wealthiest Americans, in order to give tax cuts to billionaires. And here's the insult added to that injury. Is this also this lie that we're going to be focused on the fiscal strength of our nation? They're going to give all those tax cuts away and take away health care benefits, and the result's going to be even bigger deficits. So people like Elon Musk and Donald Trump, billionaires, where most of these tax cuts will accrue to their benefit, will get more money than if you were spending $100,000 a week for the rest of your life. You wouldn't get near the net worth of Elon Musk.
The question.
Yes.
As from what I understand, and tell me if this is correct, that if they did this tricky thing that even our Republican colleagues are calling fakery and hocus pocus, our conservative Republican colleagues, that it might increase the deficit by $30 trillion. Is that accurate?
That is accurate, and that's stunning. That they know that they can't do this, so they're going to use some budget trickery to mask the truth. Math doesn't lie. Numbers don't lie. You may be able to mask it so you could use rules of reconciliation to try to force it through, but the result for the American people is going to be the same. Chuck, people will lose health care benefits, and watch the deficit of this nation not increase, explode, which means the cost of our debt payments alone are going to be more than the very programs that they're going to be slashing for families. That is outrageous, cruel, unacceptable, and we have to do everything we can as a people to stop it.
For another question.
Yes, sir.
Despite this fiscal hocus pocus, this fakery, this trickery, which my colleague has alluded to, when they cut Medicaid, when they cut Social Security, when they cut Medicare, those cuts remain just as devastating no matter what kind, is that accurate, no matter what kind of bunk they put on their balance sheets to say it doesn't matter.
I was reading stories, and many of them will live with me. There's a family that's taking care of their two parents in their 90s and their disabled adult children, desperately relying on these programs. No matter what you do or say or call it or label you slap on it, those are the kind of Americans who are stepping up to take care of their loved ones who will get hurt. Yes.
So just today, I visited a nursing home on Staten Island and a nursing home in Long Island, both in Republican congressional districts. And I spoke to people there. The nursing home I visited, if Medicaid were cut significantly, the nursing home would close, according to the head of this nursing home. He was there. 300 people would lose their jobs. And these people, hundreds of people in this nursing home, would have nowhere to go. Isn't it accurate that they say, oh, they can move in with their kids? First, isn't it accurate that many of them are in a condition where their kids can't take care of them? And second, given the housing shortages we face, and the tariffs will make that worse with the wood, isn't it true that many families just don't have room to take an elderly person, particularly one who needs care, into their homes, and that this would cause chaos to all sorts of people who are not on Medicaid themselves, but have loved ones who need it in assisted living, in nursing homes, in care facilities?
Yes, Senator Schumer, to tell a family to just double up or triple up drives up their costs. It would often, that elder that's living with them that might have dementia demands care. So that family member that's caring for them has to decide, oh my God, am I going to give up my job, which I need to pay the rent, or going to stay home and take care of them, or go to the job and let really difficult things happen? And this is the thing that the leader is pointing out that I think is really important.
One final question.
Yes, please.
Would you share something personal with us? You're taking the floor tonight to bring up all these inequities that will hurt people, that will so hurt the middle class, that will so hurt poor people, that will hurt America, hurt our fiscal conditions, as you've documented. Just give us a little inkling. The strength, give us a little feeling for the strength and conviction that drive you to do this unusual taking of the floor for a long time to let the people know how bad these things are going to be.
I appreciate the Democratic leader's question. I think that all 100 of us in this body are getting what I've gotten. I can't go to the grocery store. I can't walk my neighborhood. I just did a travel around the country to do what a lot of us elected officials do, and getting stopped in the airport by people who want to tell me stories about a parent with dementia, or a disabled child, or a child with a rare disease that has them have seizures. Story after story after story. The people who've been writing into me, some of them on scraps of paper, just to try to tell us, please. They're not saying, don't do 880 billion of cuts. They say any diminution of resources. They live on such a precipice that any diminution of resources would drive their families into crisis and despair. Many of the professionals that I'm quoting are saying, we don't need to be cutting. We need to be finding ways to extend services, to do more. How can we do more? I talked earlier about the fact that you helped with this, Senator Schumer, when we were battling, many of us, and I know my friend Lisa Blunt Rochester, she was a leader on the House, when we said, why are so many women dying in childbirth and in the postpartum period in America? Shameful that we're the worst nation of all the wealthy nations, and that's for us as a whole. But for black women, it's almost four times as much. And so what did we do here, Chuck? You remember this. Senator Schumer, what did we do here? Chuck is okay. We came together and we said, this is a time for Medicaid expansion. To say to a woman, you don't just get 60 days postpartum, but we're going to expand that beyond 60 days. State after state, red and blue states said, you're right, this is a crisis, that what should be the happiest period of a woman's life is the most devastating, with women hemorrhaging and dying. We began to treat that. And now what's the threat? The threat is that they are going to cut these things that we did to help more people, to stop more folks from dying. And here's the trick. You know this battle well. I wasn't here, Chuck. You were here, and I know my chief of staff was on your staff writing this in. And this is why you all said, we are going to try to incentivize states to expand Medicare. We're going to cover 90% of the costs. I still don't understand why some states, just to talk about cutting off your nose to spite your face, like said, no. My state, Republican governor, said, heck yeah, sign New Jersey up. But many of those states had this automatic trigger, right, that if the funding is cut, even if they say we're not going to cut $880 billion, just $250 billion, well, that's going to trigger many states to give up that Medicare expansion, go back to the days where millions upon millions of Americans don't have coverage at all. So, again, this whole speech is because Senator Schumer, business as usual in this place, when that kind of threat is happening, when the stories that I read, I had to struggle through, we should be doing hearings. We should be bringing in people. I know the values that we share on both sides of the aisle. How could we be so abjectly cruel, and why? To push through a tax break plan that families in the neighborhood I live in won't see benefits.
I thank my colleague for his strength, his courage, his effectiveness in letting the American people know how badly this upcoming bill will affect them if our Republican colleagues insist on passing it, and thank him and yield the floor back to him. Thank him for his courage and strength.
Thank you for
and effectiveness.
Thank you for allowing me to yield the floor for you to ask a question. I see my colleague here from Delaware. I'm going to read a few more stories, but I suspect that she too has a question, because she and I did not just meet when she was sworn in here in January. God bless her. She is my colleague, but she's my sister. She has inspired me for years, and when she heard I was doing this, I'm not sure how much this is done on the Senate floor, but my sister came over and prayed with me that I could stand for a long time, because she knew what we were trying to do, which was to try to create, with who we serve with, John Lewis type good trouble in this institution, to not do things normal, to begin to say that the voices I'm reading are Democrats and Republicans. The voices I'm reading are Democrat and Republican governors, Democratic and Republican heads of hospitals, Democratic and Republican heads of medical associations, Democratic and Republican constituencies. This is not right or left, this is right or wrong. And my colleague, I'm going to put her on blast, but God bless your friends that remind you of who you are when you forget. She didn't know that I really wanted to give a speech that was speaking to all of America. But she came up here, and when we were praying, she said, I pray that you speak words of love, because she and I know love is ferocious. It's the strongest force on the earth. It's not soft. It's not saccharine. She asked God to give me words of love today. And so I know that this friend of mine, my sister here, my colleague, who I've worked with for years and years and years, asked me if she could come to the floor and ask a question. So, as I've been instructed to do, if you were asking me to yield for a question, then I'm going to say, go ahead if you want to ask me.
I would ask my colleague, the great gentleman from the state of New Jersey, if he would yield the floor.
I will yield for a question. I yield for a question while retaining the floor.
I want to begin by thanking you so much, Senator Booker, for your leadership, and thank you for the opportunity to ask you a question. As I stood and listened to you, I was reminded of why we are in this place in the first place. I see my colleague, Mr. President, a member of my class, and I think one of the key things that you talked about was ensuring that we recognize that we are all in this together. I think it might have been Martin Luther King who said, we may have come over on different ships now, but we're all in the same boat now. Like, we may have come over on different ships. I feel like in this very present moment, we have to recognize we're all in this together. And to your point, when we think about the importance of Medicaid to this country, a lot of people don't even realize that they're on Medicaid. They might think of a health program that they're on, but they don't even make the connection to the fact that they're on Medicaid. That almost half of the babies in this country are born because of Medicaid. That it's not just from birth, but it goes all the way to seniors who are aging with dignity because they have access to Medicaid, and allowing their family members to go to work because they don't have to worry about that family member. And so I wanted to, number one, in addition to asking my question, say thank you to you for not only shining a light on these potential dangerous cuts, but also ringing the alarm. It is alarming that we are faced with this kind of question of, do we take money from those who are in need and are connected, because we're all connected, and give it to a few? And so, as I think about our work on maternal mortality and how we are trying to make sure that our country is not of one of the richest in the world, but the lowest in our maternal mortality numbers, as we look at issues of families who might have a family member who has a special needs child, or when I went home in our recess break, I was able to meet with folks from our disability, Developmental Disability Council, and I heard a gentleman named Emmanuel. He is a wheelchair user. He said to me something that just stuck. He said, if you pull the thread of Medicaid out of my life, it will unravel. He had been sleeping in his car before Medicaid. He wasn't sure if he was going to have employment before Medicaid. And even he and his wife thought about what impact it might have, whether they were able to stay married or whether he would have to go into a facility. And so I want to thank you for shining the light and ringing the alarm. And I want to ask you, what do you think will be the impact on children in this country without Medicaid?
I am so grateful for that question, and it sobers me when you ask it, because just a reduction in Medicaid, I love that metaphor you use, is pulling a string out for families who are barely holding it together right now. Families with children with disabilities or developmentally disabled who have been struggling so much to get their children into programs that can help move them, some of them to independence, some of them into adulthood where they can get a job. So many of these things that help to propel these children would be undermined. Just transportation services going away would create hardship and devastation on families. So here we are in America where costs are going up, housing is going up. We're about to have these awful tariffs where the price of vehicles will go up, the price of transportation will go up. And so the ripple effect of an impact on children, just by a fraction of the cuts that they're proposing, not to mention the grandeur of the $880 billion, would have a devastating impact on millions and millions of children. But it doesn't stop there. You quoted King. King said that in the letters from Birmingham jail, we're all caught in an inescapable network of mutuality, tied in the same garment of destiny. To think that there could be an injury to a family and their child and have it not affect you is not only a self-defeating ignorance, it's callous and uncaring. And it demands us to step up for those children that you so rightfully asked me in your question.
Gentlemen, yield for another question.
I will definitely yield for a question.
As the former executive of a city, a major city in this country, can you talk a little bit about the impact that these cuts will have on cities, municipalities, and states? Because some might think, oh, this is just a nice issue. No, this is an economic issue as well. If you could talk a little bit about the impact that this is going to have and why mayors across this country should care, why governors across this country should care, and city councils, why should they care?
It's the thing that is so significant. Already, governors and mayors are writing letters and speaking up. When I go to different cities in New Jersey, I'm often caught by local leaders because they know, number one, the stories of the people who rely on Medicaid, the seniors, the children, the disabled families, but more importantly than that, they know their hospitals who already have very fragile budgets to carve out millions and millions of dollars, as I told, over tens of millions of dollars for our level 1 trauma hospital in New Jersey. That would devastate the entire economic model for our hospital. It would affect jobs, it would affect the economy, it would affect small businesses, it would be devastating.
I will end my questions at the moment by saying, again, thank you so much, Senator Booker, for your leadership. We've had an opportunity to work on food as medicine, maternal mortality. There are so many more important things to work on, but the fact that you are spending your time, your energy, your intellect to stand up for millions of Americans, I commend you for that. I'm grateful to serve with you. I had the opportunity to serve with John Lewis in the House and get in good trouble, and I'm glad to be here with you in the Senate. I yield back my time.
Thank you very much. I'm going to continue elevating here throughout the hours and hours of the speech the voices of Americans from all backgrounds, all geographies, elevating the stories of leaders, Democrat, Republican, Independent. And I want to start with Matthew Cook, who's the president and CEO of Children's Hospital Association. And Matthew Cook writes, the House Budget Resolution Directive to the Energy and Commerce Committee to cut $880 billion in spending will almost certainly lead to deep reductions in Medicaid funding for children who rely on the program and destabilize the financial viability of the providers caring for them, to the point that my colleague from Delaware asked. Slashing funding would mean fewer healthcare providers, fewer services, and longer wait times for patients who already face significant barriers to care. These cuts will impact the 37 million children on the Medicaid program, including the nearly 50% of children with special health care needs. 3 million children in military-connected families. I'm going to repeat that. 3 million children who are connected to military, who are children of military-connected families. More than 40% of the children living in rural areas and small towns. Patients in rural communities would be hit especially hard as hospitals and clinics in these areas rely heavily on Medicare funding to stay open. Here's from the Mental Health Liaison Group. In the midst of our nation's ongoing mental health crisis, and I'm going to pause there. When I ran for president and moved around the country, in town hall meeting after town hall meeting after town hall meeting, I was even surprised on how many Americans, I don't think we had a town hall where someone didn't want to stand up and tell me about the mental health crisis in America and how poorly we were doing. And so when he writes off, when the Mental Health Liaison Group starts off with that, it hits me very hard. I still remember meeting with a guy in a New Jersey diner who had mental health issues, was a teacher at a high school, and stabilized his mental health because of his prescription drugs, but then stopped being able to afford them, started skimping on the drugs, had a mental health crisis, lost his job, and his whole life destabilized just because of not access to a costly prescription drug. A valued teacher had his life upended. So I start this letter again. In the midst of our nation's ongoing mental health crisis, including its devastating impact on youth and our ongoing overdose epidemic, it is paramount that access to life-saving MHSUD services is not reduced, and the integrity of the Medicaid program to serve as a vital federal and state-partnered safety net is preserved. Limiting access to Medicaid threatens to undermine gains in reducing overdose mortality rates and could lead to increasing rates of incarceration and hospitalization. And my colleague from Delaware knows this. The biggest mental health institutions in America, the biggest ones, pick your state, from Illinois to Los Angeles, the biggest mental health institutions are LA prisons, are Chicago's prisons and jails. Wasting taxpayer dollars where folks got their mental health care treatment, their lives could stabilize. They could be workers. They could be helpers. They could not be sick. Here's Chip Kahn, the CEO of Federation of American Hospitals. in quotes, key Republican lawmakers recognizing that so many constituents rely on Medicaid for official care, for critical care, made it clear that their vote today was based on an understanding that the final reconciliation bill would not include devastating cuts or changes. I believe that's gratifying, Chip Kahn writes. It is important that these members came to the same conclusion: Medicaid cuts should be off the table. Medicaid cuts should be off the table. It is up to these lawmakers to follow through and ensure spending cuts don't come at the expense of care for over 70 million Americans, including kids, seniors, and hardworking families. I love the appeal in that letter, because it was an appeal that I'm reminded of that my colleagues Lisa Murkowski and the great John McCain and an extraordinary friend, Susan Collins, when they voted to save the Affordable Care Act, they listened to the appeal of people like this gentleman. And my colleagues sitting there, and it's like often we resort to words of vicious cruelty. John Lewis didn't do that when he advocated against the most horrific racist. He didn't take on words of hate. We've got to appeal to colleagues of good conscience not to let, as this person says, no Medicaid cuts. No Medicaid cuts. I know President Trump has said that. Medicaid cuts are off the table. Said that over and over and over again. We'll see. We'll see. Modern Medical Alliance, with over 70 million children, seniors, and hardworking families relying on Medicaid for their health and well-being, it is critical Congress listens to state and local government officials, faith leaders, healthcare providers, and hardworking Americans, and blocks proposed cuts to the program. As organizations representing and caring for the millions of Americans who receive coverage and benefits through Medicaid, we know firsthand how the current level of cuts being considered by Congress would impact their care. They will cause Americans to lose coverage, reduce health access, and increase costs. We oppose any cuts. We oppose any cuts. We oppose any cuts or harmful policy changes to Americans' Medicaid benefits as part of the budget reconciliation process, and call on congressional leaders to reverse course and protect the program moving forward. Here's the Modern Medicaid Alliance. The latest House vote breaks a vital promise to more than 70 million Americans who depend on the Medicaid program and now face the potential for unprecedented, destabilizing cuts to their coverage and access to care. The full extent of cuts being considered go far beyond addressing waste, fraud, and abuse, and would undermine Medicaid coverage for those who depend on it. Already, senators are issuing stark warnings about the impact of Medicaid cuts on the stability of their communities, state budgets, hospitals, and providers. We urge members of the House and Senate to block any Medicaid cuts or harmful policy proposals as part of the ongoing budget process. Sister Mary Haddad, President and CEO of Catholic Health Association. We are deeply concerned that the budget resolution would force the House Energy and Commerce Committee to slash $880 billion from the Medicaid program, an essential health care program for nearly 80 million low-income Americans. Medicaid provides coverage for 1 in 5 individuals, funds 41% of all national births, and is the largest payer for long-term care and behavioral health services. These cuts would have devastating consequences, particularly for those in small towns and rural communities, where Medicaid is often the primary source of health coverage. Medicaid is not just a health program, it is a lifeline. It provides access to care for those who need it most: poor and vulnerable children, pregnant women, elderly, adults, and disabled individuals in our nation, while ensuring their dignity. Their dignity. Here's the Partnership for Medicaid again. The Partnership for Medicaid, a nonpartisan, nationwide organization representing clinicians, healthcare providers, safety net health plans, and counties, calls on Congress to reject cuts to Medicaid during the budget reconciliation process. The Partnership for Medicaid stands ready to work with policymakers to identify more sustainable strategies to strengthen Medicaid and improve upon its promise of providing high-quality coverage and access to care populations. Another organization saying, hey, put me in. Let us help you improve this program, and maybe we could achieve some of our mutual goals. Here is Dr. Susan Cressley, president of the American Association of Pediatrics, the great AAP. The American Academy of Pediatrics urges lawmakers to reject the budget resolution before the U.S. House of Representatives and to protect programs that are vital to the health and well-being of children. We oppose the proposed funding cuts to programs like Medicaid and the Children's Health Insurance Program, which cover nearly half of all U.S. children, as well as the Supplemental Nutrition Assistance Program. These cuts would have devastating consequences for children and families. We're going to talk about cuts to SNAP later, but I love how Dr. Susan Cressley, president of the American Association of Pediatrics, can't help but mention them together. Why is a doctor concerned about health care also mentioning SNAP? Well, fundamental to our children's health and well-being is having access to fresh and healthy foods. This is me being a little critical of people saying they're MAHA, Make America Healthy Again, and then immediately cutting kids' access to fresh, healthy fruits and vegetables. I love this doctor. It's almost like you're doubling down on the injury to our children. We're cheapening highly processed and sugar-filled, empty, nutritious foods, denying access to fresh, healthy fruits and vegetables, and then not letting people with chronic diseases get health care. I love this doctor for pointing out those connections. But now I'm going to go to Brian Connell, who is a vice president of the Leukemia and Lymphoma Society. The fiscal year 25 budget resolution would create not just the opportunity by the obligation for the House Committee on Energy and Commerce to make dangerous cuts to Medicaid program in the budget reconciliation process expected in the coming week. The hundreds of billions of dollars cuts demanded by the budget resolution cannot be achieved without slashing benefits for enrollees or altogether taking away Medicaid coverage for millions of Americans. To be clear, the Leukemia and Lymphoma Society and the patients we represent are clamoring for Congress to lower health care costs. But the framework before the House today would pave the way for policies that do just the opposite, putting affordable access to health care out of reach of millions of Americans. Feeding America, I love this organization. Cuts to vital federal nutrition programs like SNAP, necessitated by this resolution and the Senate version passed last week, will make families grappling with high food costs, hurt rural economies, and strain food banks already overwhelmed by the rising demand. We urge the House to reject spending cuts to nutrition programs in the budget reconciliation process and support the work the House and Senate Agricultural Committees are doing to create a strong bipartisan farm bill. The Federal AIDS Policy Partnership, we are writing on behalf of 95 national, regional, and local organizations advocating for federal funding legislation and policy to end the HIV epidemic in the United States. We urge Congress to reject all proposals to enact cuts to Medicaid, whether through per capita caps or block grants, restrictions to the federal Medicaid, Medi-Cal assistance percentage, or FMAP, or mandatory work requirements during reconciliation for the 2025-2026 fiscal year budgets. Medicaid is the most important source of health coverage and life-saving care for people living with HIV, the most important source of health coverage and life-saving care for people living with HIV, providing coverage for more than 40% of the people living with HIV and contributing 45% of all federal funding for domestic HIV care and treatment. The next letter starts, to be clear, the cuts outlined above are being proposed for one simple reason, to pay for $4.5 trillion in tax breaks that disproportionately benefit the wealthy. Congress can and must take a different path. Congress must take a different path, one that lifts more families out of poverty and provides more Americans with the opportunity to reach their full potential. A people-first agenda should include expanding the child tax credit for the 17 million children who don't receive the full credit due to low family incomes, expanding rental assistance, increasing SNAP benefits to reflect rising grocery prices, and closing the Medicaid coverage gap. If Congress focused on ensuring that wealthy Americans pay their fair share rather than providing additional tax breaks, we can fund these initiatives and so much more. This is a group of groups that you'll recognize, or many people will recognize: American Association of Nurse Practitioners, Gerontological Advanced Practice Nurses, the Association of National Nurse Practitioners in Women's Health, National Association of Pediatric Nurse Practitioners, the National Organization of Nurse Practitioners Faculties. They write, "We are deeply concerned with the impact of these cuts on the healthcare system and their potential to harm our most vulnerable patients. Further, these cuts will threaten the viability of practices that treat Medicaid patients, financially destabilizing and having a disproportionate impact on those who provide care to underserved and rural communities." Association of American Medical Colleges, AAMC. We remain extremely concerned that the budget resolution's reconciliation instructions would result in unsustainable cuts to federal health care programs, specifically Medicaid, by requiring at least $880 billion in savings from the House Energy and Commerce Committee. Cuts of this magnitude would jeopardize both access to care for millions of Medicaid enrollees and the financial stability of the providers who care for them. Here's one from Chimes International, or Chimes International, forgive me, Chimes. Cuts in Medicaid will have a dramatic negative impact on our healthcare system and the first responder community. Millions of Americans will be at risk of losing access to housing, thereby increasing homelessness for some of the most vulnerable members of society, especially in areas that already lack affordable housing. Provider organizations like ours will be forced to close the doors of residential facilities and reduce support staff, which is already in short supply. Katie Smith Sloan, who is the president and CEO of Leading Age, states would have to fill in massive budget holes if federal funding to Medicaid programs were cut. Even if a cut, such as the change to the expansion FMAP proposal, does not seem to directly impact aging services, it would, because the cost of the cut would have to somehow be absorbed by state budgets. That type of hole cannot be filled in via more efficiency. Balancing the 10-year program budget cycle on the back of Medicaid program is not a good trade-off for the American people. Alan Morgan, who is the CEO of the National Rural Health Association, this letter is powerful. He represents the National Rural Health Association. Any cuts to the Medicaid program will disproportionately affect rural communities. Rural Americans rely on Medicaid coverage, with about 20% of non-elderly adults and 40% of children living in rural areas enrolled in Medicaid and CHIP. In almost all states, rural areas have higher rates of Medicaid enrollment than metropolitan areas. Cuts to Medicaid would shift healthcare costs onto rural families, many of whom already struggle with financial instability. Medicaid cuts would force families to face higher out-of-pocket expenses, leading many to delay or forego necessary treatments. The burden would worsen health outcomes, especially for those managing chronic conditions like diabetes, heart disease, and cancer. To the extraordinary prescience of my colleague from Delaware, who knew this letter was coming, I imagine. This is a letter from the U.S. Conference of Mayors, the National League of Cities, the National Association of Counties, the National Conference of State Legislators, the Council of State Governments, the International City-County Management Association. I'm going to pause for a second just to remind folks, because I've been involved in the U.S. Conference of Mayors, National League of Cities. I've dealt with the National Association of Counties on things that were important here in the Senate. All of these groups are bipartisan. All of these groups represent Democrat and Republican mayors, Democrat and Republican city council people. I was actually nonpartisan mayor. Newark does not have partisan elections. So they have nonpartisan folks. This is a group of people who have those jobs where the rubber meets the road. A change in state policy, a change in federal policy, we had to eat it when I was mayor, if it cost us more money. I was a mayor that talked like lots of mayors do, not in partisan lingo. They just talk about, hey, that's an unfunded mandate. Hey, that's adding more bureaucracy. Hey, that's going to cause more people in my community to be homeless. It's going to cause more children in my community to use an emergency room as their primary care physician. When I meet a mayor, I look at them and I thank them because it's one of the hardest jobs in America. So this organization that represents Democrats and Republicans, they write, as a coalition of bipartisan membership organizations representing state legislators, mayors, cities, and counties, we are committed to working collaboratively to strengthen the Medicaid program so that the states and localities can continue to meet the needs of their residents effectively. We write to express concern over proposed changes to Medicaid financing and requirements that could significantly impact state and local budgets, healthcare infrastructure, and millions of Americans who rely on the program. I would say so far there's at least half a dozen to a dozen of these letters where bipartisan groups are saying, let us help you. Don't rush this through in a way that is going to cause havoc to state and local governments, cause havoc to children and seniors and the disabled, cause havoc to hospitals and businesses, cause havoc to rural communities, cause havoc to the idea of what it means to be an American, that we take care of our own, that we stand up for each other, that we lend a hand, that we lift folks up. And here it is, this voice of bipartisan sensibility that says, hey, hold a hearing, we'll come. Put some of us on a commission. There's a group that is called Advocates for Community Health. Medicaid successes as a national program derives from its variations across different states doing things in different ways. Medicaid looks different in every state and territory because the program is able to reflect and accommodate the specific needs of the state's patients, providers, and communities. These state-based programs are vital to the patients served by community health centers, patient-directed primary care providers that serve rural and underserved communities nationwide. As the House and Senate work towards a budget reconciliation package, Advocates for Community Health encourages a cautious approach to changes to Medicaid policy, as broad changes have the potential to destabilize state Medicaid programs and community health centers, impact local economies and job creation, and further exacerbate rural health care access challenges. The Families USA, their executive director, his name is Anthony Wright. Americans are storming town halls, calling their representatives in Congress, and demanding that House Republicans stop their plan to massively cut the health care that Americans want and need. President Trump and some Republicans have said they won't touch Medicaid, but their vote today is when we see who walks the walk. The vote is the walk the plank moment for moderates who say they don't want Medicaid cuts, but are being asked to cut over $880 billion to the care and coverage of their constituents. Policymakers and public alike understand that there is no version of this budget resolution that does not include deep cuts to vital programs, services, and benefits that the American people use every day to help them see a doctor, pay rent, or feed their families. Justice in Aging, it's an organization that's led by its executive director, Kevin Prindiville. He writes, with this vote, lawmakers endorsed taking away Medicaid from millions of Americans, including older adults, all to bankroll tax cuts for the wealthy. Thanks to our collective advocacy, the vote to pass this dangerous budget blueprint did not come easily. And we will make sure lawmakers know that voting to enact these cuts would be voting to abandon older Americans. The National Alliance for Caregiving. The House budget blueprint to eliminate at least $800 billion in federal funding unfairly targets criminal health care and supportive services that older adults, people with diabetes, and their family caregivers depend upon to maintain health and economic security for families and themselves. Home and community-based services funded via Medicaid are cost-effective. They save millions of taxpayer dollars on unnecessary and often unwanted institutional care. Most of all, Medicaid-funded HCBS, home and community-based services, offers consumers a choice in how they receive care, in the dignity of their own homes. In the dignity of their own homes. Dignity. The Coalition for Whole Health Legal Action Center. Among the options being discussed are work requirements for enrollees, despite the fact that most people receiving Medicaid do work, and other cuts to federal funding that would disproportionately harm people with substance abuse and mental health conditions, and those with arrest and conviction records by making it harder to access critical health coverage and service, medications, and supports. Such individuals already face pervasive stigma and discrimination, including significant barriers to employment that threaten their stability and well-being. At a time when overdose and suicide are claiming more than 400 lives a day, we cannot afford to reduce access to comprehensive healthcare services that people with substance abuse use, mental health conditions, and those rebuilding their lives after incarceration desperately need to recover and thrive. So let me tell you something about that really strikes me. I was blessed to go to colleges, and there people would use drugs. And now I live in a community where the consequences for drug use often means jail time. In fact, if you look at low-income people, their chances of being incarcerated are far greater than college kids who have drug usage rates at about the same. And so now you say to somebody who's got an arrest record, serve some time, that when they come out, they can't get help? Or people with mental illness are over-incarcerated, and you're going to say to them, you've got this mental illness, now you've got a record, and you also can't get health care services? That's again, self-defeatist when it comes to our nation trying to give people ways of elevating themselves above their past mistakes or the diseases that challenge them. Here's another group, community catalysts. These cuts will hit hardest where healthcare access is already fragile. Here's the Alliance for Aging Research. We, the undersigned organizations, urge you to oppose any cuts to Medicaid and the Supplemental Nutrition Assistance Program, SNAP, including those called for in the proposed budget resolution. We are concerned about the negative impact these deep cuts will have on the Americans living with chronic disease and other disabilities. But we are willing to draw your attention now to how devastating they will be on those with Alzheimer's and related diseases, including frontotemporal degeneration and Lewy body dementia and their family caregivers. April Verrett, president of SEIU. Let's be clear. Americans have flooded congressional phone lines, rallied at town halls, and lifted their voices to make it clear that they do not want massive cuts to the health care and public services they depend on. Despite that, today, Speaker Johnson pressed a budget resolution forward that puts our nation on a disastrous path to ripping away health care from 80 million children, pregnant women, veterans, seniors, people with disabilities by gutting Medicaid. Lee Sounder, the president of AFSCME, this budget proves that extremists are more concerned with giving wealthy trillions in tax cuts than helping working people. Voters across the country are packing town halls to demand no cuts to Medicaid and SNAP. They're calling representatives asking them, please, save these services. They want their elected leaders who will lower rising costs, who will make it easier to afford rent and food. But instead of listening to workers, the House moved forward on a budget plan that will cause millions to lose their health care, increasing food insecurity for families, and jeopardize Medicare and Social Security in the long term. He calls this shameful. The Diabetes Leadership Council and Diabetes Patient Advocacy Coalition. We are deeply concerned about the budget resolution passed in the House of Representatives this week. This budget resolution will likely lead to cuts to the safety net Medicaid programs, which provides health insurance to almost 80 million Americans, including children, pregnant women, elderly adults, people with diabetes, and low-income adults and families. This action would disproportionately impact Americans who most need us, including those with diabetes or other chronic conditions who rely on Medicaid to access medications and technology that they need to manage their conditions. Members of Congress should instead work to ensure access to health insurance. Through the Medicare program, work to ensure access to health care without barriers for the most vulnerable Americans. Here's the Alliance for Childhood Cancer. Work requirements may also impact caregivers of children with cancer who are unable to work due to the demands of cancer treatment for young adults with cancer who may not be eligible for insurance via their employer or may not be able to work due to their diagnosis. Many young adults rely on Medicaid, especially the Medicaid expansion for coverage, and research shows a clear increase in survival for young adults with cancer in Medicaid expansion states. Unidos US. The proposed resolution would slash at least $880 billion from programs that have long provided life-saving, affordable coverage to millions of Americans. Medicaid alone serves 80 million people, covering nearly 40 million children, half of those with special health care needs and more than 40% of all births. In Latino communities, Medicaid reaches 20 million individuals, protecting nearly 1/3 of community members, more than half of Latino children, and roughly 30% of Hispanic elders. Without these vital programs, there'll be higher hospitalization rates, delayed diagnoses, and increased mortality. This would become the norm, placing an unsustainable strain on public health and national financial security. As Unidos US recently pointed out, these proposed cuts would represent the largest cuts to Medicaid in US history. The Coalition of Survivors of Domestic Violence and Sexual Assault, on behalf of the adult and child survivors of domestic violence and sexual assault, we serve and advocate for them. We, on behalf of them, write to ask you to reject cuts to federal Medicaid funding. Survivors rely on Medicaid every day to escape abuse, to rebuild their lives after violence, to care for their children and families. Catholic Health Association of the United States and the United States Conference of Catholic Bishops and Catholic Charities USA. Weakening Medicaid through structural challenges such as per capita caps or block grants would undermine these values and risk leaving millions without access to essential health services. Furthermore, policies like work reporting requirements have shown clear evidence of creating artificial barriers to care, generating paperwork and bureaucracy while doing little to support people looking for work. These requirements also fail to recognize that most people on Medicaid already work and ignore the realities of low-wage workers. Caregiving responsibilities, health limitations, and studies have shown they frequently result in loss of coverage for eligible individuals and children. The Disability and Aging Collaborative and the Consortium for Constituents with Disabilities, on behalf of 107 national organizations and more than 230 state and local organizations. The undersigned members of the Disability and Aging Collaborative, the Health and Long-Term Service and Support Task Forces of the Consortium for Constituents with Disabilities, and allied organizations write to urge you to exclude Medicaid cuts, work requirements, or any changes that limit funding or eligibility from budget reconciliation or other legislation. People with disabilities, older adults, family caregivers and their children, direct care workers, and other low-income individuals and families depend on Medicaid every day for their health, safety, and independence. Medicaid enables our communities to go to work and to care for loved ones. It is our community's lifeline, and we cannot afford for any part of it to be cut. The Jesuit Conference. Programs that meet basic needs, such as SNAP, Medicare, and Medicaid, health insurance, premium tax credits, and Social Security, should be protected and remain as robust as possible. We oppose modifications that would have the effect of reducing important benefits or excluding vulnerable people from participating. Thank you, the Jesuit Conference. Why? I mean, we have just read dozens and dozens of letters from real people who are relying on these programs to take care of their elderly parents, take care of their loved one with dementia, to take care of their children, to take care of their adult children with disabilities, to take care of their children with special needs, to take care of their families, to take care of their communities, to take care of rural towns, to take care of the hospitals, to take care of people. Why? Why? Why are all of these people lifting their voices now, pointing to the crisis that can't be normalized, pointing to the challenges? Because we've seen this reconciliation process call for $880 billion of cuts, when, as I read earlier, there's only one place that the majority of those cuts can come from, and that would be hundreds of millions of dollars of cuts to Medicaid, which organization after organization told you it is already a delicate balance, that cuts to these programs could ultimately tear down people's access to life-saving benefits. People use the word dignity over and over again. Dignity, it is a value in our country, that we treat our elders with dignity, that we give people struggling with chronic disease dignity, that we give parents who are slammed with the unimaginable diagnoses for their children, we help them to access dignity. People that we talked about, that read their letters, they all said, we can help you find efficiencies. We can help you make the programs work better. We can help you. But why are you doing this if it is all part of a larger package to give tax cuts to the wealthiest Americans, to give tax cuts to billionaires? How does that work? That Elon Musk should get richer and richer and richer, and families who the love in these letters, who love their children, who love their aging parent, who love that person with dementia, even though they don't recognize them anymore, but that doesn't stop their heroic love. And they piece together their finances in a nation where housing costs are going up, food costs is going up, transportation is going up. They piece together the fragile finances of their lives. The Medicaid funding is one part of it that gets yanked away and everything unravels. Why, they ask? Why? They plead for help. They ask us to do something. I want to read some articles coming from a variety of backgrounds. But perhaps this one from PBS, a closer look at who relies on Medicaid. This is what PBS wrote. As congressional Republicans seek about $4.5 trillion, $4.5 trillion to extend expiring tax cuts, the federal government will need to find savings elsewhere. If you're going to give those $5.5 trillion that disproportionately go to the wealthy, you're going to have to find savings elsewhere. Experts say budget cuts could affect Medicaid coverage for as many as millions of Americans at a time when the program may need more funding, not less. The proposed House bill requires the Committee on Energy and Commerce to find $880 billion in spending cuts, which means some aspects of Medicaid, which the committee oversees, may be on the chopping block. Medicaid is a massive program that provides free and reduced cost health care for eligible enrollees. It offers critical coverage to a wide variety of Americans, including children, adults with disabilities, and older people in nursing homes. Even for Americans who have private insurance, Medicaid can play a part of their health care. That's because Medicaid is such a large ending of funding that so many aspects of the country's, so many benefit from the aspects of this country's health coverage. The public health insurance option is funded in part by the federal government and in part by states, covering around 72 million Americans. The government spends about $880 billion on Medicaid in fiscal year 2023, the most recent year for which there's data, according to an analysis by the nonprofit health policy research organization KFF. Medicaid is an extremely popular entitlement program, said Robin Rudowitz, director of the program on Medicaid and the uninsured at KFF. More than 9 in 10 adults say Medicaid is very or somewhat important to their local community, according to recent KFF polling. 40% of respondents said they wanted Medicaid funding to remain the same, while 42% wanted to increase funding for the program. Just 17% wanted to decrease funding a little or a lot. Some studies have found that expanding Medicaid can save money for states, including in spending reductions in corrections, healthcare, as well as mental health and substance abuse. Pulling away from the article for a second, that's so logical. Expanding health coverage for people with mental health challenges or substance abuse means an investment now and saves a lot of money to society later and saves them from being rearrested because of their disease. Back to the article. President Donald Trump has said his administration will not cut Medicaid benefits and will instead reduce spending by eliminating waste and fraud. Well, according to health policy experts, there may not be a way to fund the tax cuts without gutting Medicaid. Doing that will have real implications, said Allison Orris, Senior Fellow and Director of Medicaid Policy at the Center on Budget and Policy Priorities, another nonpartisan group. It's fair to say that if Medicaid is cut by hundreds of billions of dollars, people will lose coverage. But some of the ways in which they will lose coverage and health care access are a little bit tricky, she said. So who and what relies on Medicaid? Medicaid covers low-income Americans in all 50 states, as well as D.C. and the American territories, but the program's benefits are farther reaching. Medicaid pays for around 2 in every 5 births in the country. The program accounts for about 20% of both hospital funding and total health care spending nationwide, according to KFF. That organization's analysis of hundreds of studies concluded since 2014 largely found that Medicaid expansion helped cut hospital costs associated with uninsured patients. Many studies also found that Medicaid expansion helped with overall hospital funding and resulted in fewer hospital closures. And Medicaid, not Medicare, is the single largest payer of long-term coverage, including nursing home care. Here are some of the ways Medicaid is crucial for so many Americans' health care. Long-term care for people with disabilities. According to KFF analyses, 35% of Americans with disabilities have Medicaid. It's about 15 million people. That compares with 19% of people without disabilities, and the majority of whom have employer-provided health insurance. Currently, Medicaid covers about 60% of long-term care coverage, much of which provides care for younger adults with disabilities. Nursing homes. Medicaid is the primary payer of nursing care in the United States. It covers 63% of nursing home residents. For many older adults, Medicaid is the safety net. David Grabowski, professor of healthcare policy at Harvard Medical School, says an individual can be middle income their entire life and then reach the older long-term care years and have to enter a nursing home. Because nursing homes can be so expensive, families can quickly deplete all of their assets, then rely on Medicaid to cover long-term care. Another group, children. 37% of people enrolled in Medicaid are children, but they account for only about 15% of the program's spending. In 2023, KFF found that of the 72 million people enrolled in Medicaid, about 30 million were children. Millions more children are enrolled in the Children's Health Insurance Program, which some states run with Medicaid expansion funds. They're tied. Forgive me, that's off this article. Back to the article. So far, political conversations have not yet focused on cutting CHIP. Rural maternal health. Medicaid covered around 40% of births nationwide in 2023, KF found, and nearly 50% of all rural births. Studies also show that being enrolled in Medicaid leads to improved health outcomes for children, including declines in infant and child mortality, preventative care visits on par with privately insured children, and even potentially positive outcomes into adulthood, such as improvements in education. That's what studies show being enrolled in Medicaid leads to. How about Native Americans and Alaskan Indians? 4 in 10 American Indian, Alaskan Native people are enrolled in Medicaid, the highest enrollment rate among any race and an ethnicity category. This includes about 23% of non-elderly AIAN adults and 44% of American Indian, Alaska Native children. How the federal government funds states' Medicaid plans. Medicaid began as an optional program in 1966 alongside Medicare, with around 8 million people eligible for enrollment. By the 1980s, all states had opted into providing health insurance through Medicaid. Though eligibility requirements have changed over the last 60 years and vary by state, the most significant change to Medicaid was the enactment of the Patient Protection and Affordable Care Act in 2010. It requires states to cover adults with incomes up to 138% of the poverty line. After the Supreme Court ruled in 2012 that expansion for states should be optional, 40 states and Washington, D.C. have expanded Medicaid. 40 of our 50 states accepted federal funds at a much higher rate than the match rate for non-expansion. That is a good summary by PBS of how far-reaching this program is. How many Americans in every single state from all backgrounds, both sides of the political aisle, independents, old, young, hospitals, businesses, care professionals, and more. This is who we are. We've expanded the program. We've made it better. We've brought improvements. And yet we're doing a process, it's not going through a committee. We're not soliciting the best ideas from both sides of the aisle about how to make it more efficient, more effective. We're not bringing in private sector professionals to give advice and input, or hospital providers, or people that are seeing things that we could learn from and craft legislation to make the program better. And the letters are even showing we're not even doing any of those things, and then we're cutting the very programs that allow people access to fresh, healthy food that then cause us to need more health care for chronic diseases. This alone would be bad enough if we were gutting a program with no input from professionals, if we were taking away health care from seniors, children, expectant mothers, the disabled. That would be bad enough. But why? Again, why? Because it's part of a larger budget package to give trillions of dollars of tax cuts disproportionately to the wealthiest Americans, and still add trillions to the national deficit. I talked about American Indian and Alaska Natives. I mentioned that. I've recently visited some proud Native Americans and heard their stories and was inspired by their conviction and their grit, and how under incredible odds they were able to create better lives after extraordinary oppression and vicious policies and more. They found a way forward. There's a disproportionate number of Native Americans and Alaska Natives that rely on these programs. People who have maintained extraordinary dignity despite promises made and promises broken. So many people are talking about that idea of a sacred trust that the richest nation in the world, to honor its ideals of freedom, has to focus on keeping people free from fear that one medical bill will throw their family in crisis, or fear that one diagnosis for their child will unravel their lives, or fear that if their parent gets dementia, there'll be no care for them. So much of this conversation is within this larger understanding of who we are and what do we stand for. I want to take a look at some of the things the Trump administration is doing that is going to undermine not just Medicaid, but health insurance coverage for Americans, for all Americans, and raise the cost of health care and negatively impact our health at a time when basic prices of everyday goods are going up. The president is making health care harder to access and drug prices even higher. I want to explain this. On his first day back in office, Trump rescinded a policy that extended the enrollment period for ACA plans. This policy gave Americans sufficient time to enroll in health care for the year, and enrollment in the ACA continues to go up as people see how affordable this program is and how they can get quality health care. But one of the first things he does is rescind a policy that extended the enrollment period. In addition to this, Republicans in Congress want to take away the tax credits that make health care more affordable for so many people. Millions of working-class Americans rely on Affordable Care Act tax credits to access affordable, quality health care and coverage. I could go on with the things. For example, currently these tax credits, they're set to expire at the end of this year. If these tax credits are taken away, families will pay up to 90% more for their health care, and 5 million Americans could lose their health care altogether. All again, if this goes through in 2025, billionaires and CEOs will get a huge tax break while working Americans relying on this tax credit will lose it. Think about that. This would allow billionaires and CEOs to get more of a tax break while these tax credits that help more Americans access health care would expire. For New Jerseyans, ending the ACA tax credit would make health insurance less affordable for 352,000 hardworking people and their families, and would force 75,000 people to go uninsured, 75,000 people in my state alone. Last year, 24 million people chose Affordable Care Act plans during the most recent open enrollment period due to these expanded tax credits that made plans available for people for little or no monthly premiums, and extended the enrollment period, which I just said the president has rolled back. President Trump also overturned an effort for Medicare to lower drug costs, like implementing a $2 monthly out-of-pocket cap on certain generic drugs, as well as a measure that would reduce Medicare payments for rare disease drugs and drugs that treat life-threatening conditions. I just don't understand that one. I really see that as cruel. Americans struggling to afford their drugs had a cap of out-of-pocket expenses on certain generic drugs, and that was overturned. Costs are going up. Costs are going up. And now this president is expanding costs for out-of-pocket generic drugs, as well as Medicaid payments being eligible for rare diseases. I had the privilege of becoming close to John McCain. I came here in the Senate and got this admonition almost from Bill Bradley, somebody who held my seat beforehand, and he challenged me to go and have lunch with or meetings with all my Republican colleagues at the time. That was way back in 2013. And I was told by John McCain's staff that I had like 10, 15 minutes. But I was going to take it. This is John McCain. He's a legend. And I go in and I meet with him. And I didn't come out of that office for about 90 minutes. And we both got emotional as he showed me pictures and documentation from his time as a prisoner of war. In 2017, he was under extraordinary pressure in this healthcare crisis. And there were thousands of Americans descending on our Capitol. I'll never forget the little lobbyists, they called themselves, kids in wheelchairs, that would roll up to congresspeople and raise their little voice respectfully and ask them not to take away their health coverage. I remember people coming in here with pre-existing conditions and say, don't repeal my health care, and not even have a plan to replace it. President Trump was asked about health care when he was candidate Trump for this office, and he said he had, I think it was conceptions of a plan. And since he's been in office, I haven't heard a vision for health care besides budget proposals that would cut people's health care. But John McCain, I will never, ever forget that moment. I was actually standing on the Republican side, if I remember correctly, having conversations, and he came to the floor after listening to Arizonans tell stories like the ones I've been reading and put his thumb down. He wrote a speech about his decision, and I want to read a part of that now. I have been a member of the United States Senate for 30 years. I had another long, if not as long, career before I arrived here. Another profession that was profoundly rewarding and in which I had experiences and friendships that I revere. But make no mistake, my service here is the most important job I have had in my life. And I'm so grateful to the people of Arizona for the privilege, for the honor of serving here and the opportunities it gives me to play a small role in the history of the country I love. I've known and admired men and women in the Senate who played much more than a small role in history. True statesmen, giants of American politics. They came from both parties and various backgrounds. Their ambitions were frequently in conflict. They had different views on the issues of the day. And they often had very serious disagreements about how to best serve the national interest. But they knew that however sharp and heartfelt their disputes, however keen their ambitions, they had an obligation to work collaboratively to ensure the Senate discharged its constitutional responsibilities effectively. Our responsibilities are important, vitally important, to the continued success of our republic. And our arcane rules and customs are deliberately intended to require broad cooperation to function well at all. The most revered members of this institution accepted the necessity of compromise in order to make incremental progress on solving America's problems and to defend her from her adversaries. That principled mindset and the service of our predecessors who possessed it come to mind when I hear the Senate referred to as the world's most deliberative body. I'm not sure we can claim that distinction with a straight face today. I'm sure it wasn't always deserved in the previous eras either, but I'm sure there have been times when it was, and I was privileged to witness some of those occasions. Our deliberations today, not just our debates, but the exercise of all of our responsibilities, authorizing government policies, appropriating the funds to implement them, exercising our advice and consent role are often lively and interesting. They can be sincere and principled, but they are more partisan, more tribal, more of the time than any other time I remember. Our deliberations can still be important and useful, but I think we'd all agree they haven't been overburdened by greatness lately. And right now, they aren't producing much for the American people. Both sides have let it happen. Let's leave the history of who shot first to historians. I suspect they'll find we all conspired in our decline, either by deliberate actions or neglect. We've all played some role in it. Certainly I have. Sometimes I've let my passion rule my reason. Sometimes I made it harder to find common ground because of something harsh I said to a colleague. Sometimes I wanted to win more for the sake of winning than to achieve a contested policy. Incremental progress, compromises that each side criticize but also accept, just plain muddling through to chip away at problems and keep our enemies from doing their worst, isn't glamorous or exciting. It doesn't feel like a political triumph, but it's usually the most we can accept from our system of government. Operating in a country as diverse and quarrelsome and free as ours. Considering the injustice and cruelties inflicted by autocratic governments and how contemptible human nature can be, the problem solving our system does make possible, the fitful progress it produces, and the liberty and justice it preserves is a magnificent achievement. Our system doesn't depend on our nobility. It accounts for our imperfections and gives an order to our individual strivings that has helped make ours the most powerful and prosperous society on earth. It is our responsibility to preserve that, even when it requires us to do something less satisfying than winning, even when we must give a little to get a little, even when our efforts manage just 3 yards in a cloud of dust, while critics on both sides denounce us for timidity, for our failure to triumph. I hope we can again rely on humility, on our need to cooperate, on our dependence on each other to learn how to treat each other again, and by so doing better serve the people, by learn how to trust each other again, and by so doing better serve the people who elected us. Stop listening to the bombastic loudmouths on the radio and television and the internet. To hell with them. They don't want anything done for the public good. Our incapacity is their livelihood. Let's trust each other again. Let's return to regular order. We've been spinning our wheels on too many important issues because we keep trying to find a way to win without help from across the aisle. That's an approach that's been employed by both sides. Mandating legislation from the top down without any support from the other side, with all the parliamentary maneuvers that requires. We're getting nothing done. All we've really done this year is confirm Neil Gorsuch to the Supreme Court. Our healthcare insurance system is a mess. We all know it. those who support Obamacare and those who oppose it. Something has to be done. We Republicans have looked for a way to end it and replace it with something else without paying a terrible political price. We haven't found it yet, and I'm not sure we will. All we've managed to do is make more popular a policy that wasn't very popular when we started to try to get rid of it. I voted for the motion to proceed to allow debate to continue and amendments to be offered. I will not vote for the bill as it is today. It's a shell of a bill right now. We all know that. I have changes urged by my state's governor that will have to be included to earn my support for final passage of any bill. I know many of you will have to see the bill change substantially for you to support it. We've tried to do this by coming up with a proposal behind closed doors in consultation with the administration, then springing it on skeptical members, trying to convince them it's better than nothing, asking us to swallow our doubts and force it past a unified opposition. I don't think that is going to work in the end, and it probably shouldn't. I mean, that is prescient. That is prescient. As a great New Jerseyan, Yogi Berra, said, that feels like deja vu all over again. Do you hear what John McCain was criticizing? One party, behind closed doors, without consultation of experts, against the wishes of Republican governors, is trying to force something through past a united opposition. He literally is describing what's happening right now and condemning both sides of this institution for playing this record over and over and over again. Yes, I'm a Democrat, and I admit that our healthcare system needs so much help and so much reform. 1 out of every 3 of our tax dollars is being spent on healthcare. That's ridiculous. And what are we getting from it? A society that's getting more and more sick. And what of our solutions as a body? Did we come together as a team? Did we set up a special conference, set up a special committee to study the issues, to bring in the experts, to involve the best technology, to learn the lessons from private sector and public sector, from universities, from scientists? Are we doing that, or are we doing exactly what John McCain said we shouldn't do, exactly what he described, why he voted no? It is maddening in this country to create greater and greater healthcare crisis, and for us not to solve it, but to battle back and forth between trying to make incremental changes or to tear it all down with no plan to make it better, leaving more Americans suffering what is still one of the most significant ways people go bankrupt, which is not being able to afford their health care. And what are we doing it for this time, John? Senator McCain? I know you wouldn't sanction this. I know you would be screaming. I've seen how angry you can get, John McCain. I've seen you tear people apart on this floor, Democrat and Republican, for doing the same stupid thing over and over again. Listen to John McCain. Explain why he voted no the last time the Republican Party tried to unite and tear down health care with no idea how to fix it and threatening to put millions of Americans in financial crisis and health care crisis. I can't believe we are here again. with thousands upon thousands upon thousands of Americans writing letters, storming into town halls, hospital leaders, private sector leaders, Republican governors, Republican mayors, Democratic governors, Democratic mayors, all saying, what are you doing in Congress? And why? I think what's even more outrageous this time is the why. To redo the tax cuts that independent budget analyses know that the overwhelming benefit went to the billionaires that sat on stage with Donald Trump during his inauguration. We're not saving any money in our budgets. Their plan is to expand our budget crisis. Their plan will add trillions of dollars to our budget and give tax cuts to the wealthiest and not help the people that John McCain is talking about. His echoes haunt me that he said, we are mistaken when we don't come together across the aisles, across our differences, to try to make things better. There is a healthcare crisis in this country. 1 out of 3 dollars in our government is going to health care, and we have more chronic disease in this nation than we have ever had before, and there's no solution being offered in this reconciliation to deal with that. In fact, we're making it worse because we're denying children access to healthy foods. This is ridiculous. If they're successful, what kind of country will we be? With more stratifications of wealth, with people who have done so good. I'm not one of these Democrats that hate successful or wealthy people. Heck, people in my neighborhood, the only senator that probably lives in a low-income neighborhood, strive to be wealthy. They are doing great. The top quartile of our country for the last 20 years has made extraordinary wealth. God bless them. But when you see that 70, 80% of Americans don't want Medicaid cuts, it's because most Americans know neighbors, family members, church members who rely on Medicaid. They know that their grandmother in a nursing home relies on Medicaid. They know that the disabled child next door relies on Medicaid. And now we want to gut it? $880 billion? You're John McCain. Most people remember the thumb down. They don't remember his words. They don't remember the warnings. This man is in heaven now, and his words, they speak to us in this moment again. Why won't we listen to them? Our deliberations today, not just our debates, but the exercise of our responsibilities, authorizing government policies, appropriating the funds to implement them, they can be sincere in principle, but they are more partisan, more tribal, more of the time than any I remember. Our deliberations can still be important and useful, but I think we'd all agree that they've been overburdened. And right now, they aren't producing much for the American people. Both sides have let this happen. Let's leave the history of who shot first to the historians. I suspect they will find we all conspired in our decline, either by deliberate actions or by neglect. Listen to John McCain. Our system doesn't depend on our nobility. It accounts for our imperfections and gives an order to our individual strivings that has helped make ours the most powerful and prosperous society on earth. Listen to us. Let's trust each other. Let's return to regular order. We've been spinning our wheels on too many important issues because we keep trying to find a way to win without the help from the other side. That's an approach that's been employed by both sides, mandating legislation from the top down without support from the other side. We're getting nothing done. All we've done this year is to confirm Neil Gorsuch. I voted for the motion to proceed to allow debate to continue and amendments to office. I will not vote for the bill as it stands today. I will not vote for the bill. We've tried doing this by coming up with a proposal behind closed doors in consultation with the administration, Donald Trump, then signing it on, then springing it on skeptical members, trying to convince them it's better than nothing, asking us to swallow our doubts and force it past a unified opposition. I don't think that is going to work in the end, and it probably shouldn't. Well, this shouldn't work either. This shouldn't work either. This is wrong. This is wrong. I see the leader here. I'm sorry, sir. I should be conserving my energy.
Would the gentleman yield for a question?
Yes, I would yield for a question while retaining the floor.
First, your impassioned remarks are so meaningful. I hope all of America is watching. And if some people are not up at this hour, watch it tomorrow. It's inspiring. And I would just ask my colleague a question. I was there. I spent 4 hours with John McCain before he voted, and we talked and talked and talked and went over the courage of his father and his grandfather in the Navy and the courage that he hoped to show, as they did. And I'd ask my colleague this question, isn't it eerily reminiscent that after John McCain did his courageous act, that here we are, years later, almost a decade later, a few years less, and they're doing the same thing again, cutting people's health care to give tax breaks to the wealthiest people. And isn't it true that John McCain saw the suffering of people who wouldn't get health care and urged people to come together on a bipartisan solution? And wouldn't it be much better if our colleagues from across the aisle, they may not agree with us on everything, but instead of trying to jam another bill down our throats like they did back in 2017, came and worked with us for the betterment of the country, for the betterment of the 80% of the people who need health care, who will struggle without that health care? Some will be ill, some will die. So does it strike the gentleman that how could the people on the other side of the aisle try to do this again after John McCain made such a courageous stance? It's not echoing. It doesn't seem to be echoing in their ears, is it? I'd ask my colleague to just answer that general line of questioning.
So Collins, Murkowski, and McCain, I think it took a lot of courage. They were getting a lot of pressure from the White House. John McCain was viciously attacked afterwards. But his private conversations with members, and you, Senator Schumer, know at the last lap around his track of life, he didn't want to be remembered as someone doing something, to use John McCain kind of language, boneheaded, to hurt a lot of innocent, fragile people and leave them without a plan. When his own governor, Republican governor, I read Republican governors earlier, were saying, don't do this. I want to say something else to the senator in response to his question. I watched you that night, and I just loved something you did, and I've never said this to you. People over here tried to start applauding, and you stood up angrily and told them not to. Because what John showed was something bigger than partisanship. He talks about it, one side trying to win, the other side trying to, it's more ego sometimes than it is ideals. And you stood up and said, no, this is not that moment. We're watching a man take a position that was not easy, that didn't serve his politics, but served his spirit. I don't know if my staff has that envelope of the articles that I wanted specifically, because there's a story in there, and if I don't have it now, I'm going to read it later, about John McCain in the prison camps. But I wasn't here when we had this moment. But when I got here, weeks after this moment, Mr. Leader, all my colleagues on both sides of the aisle wanted to talk about it. It was a special conference in the old Senate chamber. I was not there, but the Democrats and Republicans, it actually changed our behavior in here. It didn't last, but I came here and people said, because of that, we're all going to partner up. And for State of the Union addresses, you have a Republican partner and a Democrat. We go as couples, basically. It was something about this man where the dignity that he had, that we all treasured, in a moment like that, that he began to elevate. I had my partner senator here say to me, when I got here, you are not a full senator until you get ripped by John McCain's anger. And
I'm well aware.
Okay, and I never got ripped by him. After my meeting I mentioned earlier in his office, he started inviting me with him. My first Codell was with him and he told me all the time, Booker, there are two types of senators here. I don't mean that he was casting aspersions on others. There are people that represent their states, and there are statesmen. And he kept challenging me, be a statesman. Not a great Democratic senator, but be a great American senator. He would challenge me over and over and over again. I would go to his national security conferences out at his ranch. And one of my favorite moments as a senator, if I had top 10 favorite moments as a US senator, this is one of them. The leader knows that I am a vegan. And when you go to one of his open barbecues, there is nothing vegan. I mean, they even saturated every vegetable in butter, and mayonnaise was everywhere. But I'm not going to complain. I'm just going to sit and enjoy the conversations. And so now I'm in a golf cart going home at the end of the night, and the young man who was shuttling me home goes to me, "How was the food? Did you enjoy the dinner?" And I go, "Well, actually, if I'm going to be honest, I didn't eat." And they go, "You haven't had dinner?" And I go, "No." I said, "I'm a vegan." And they go, "Well, we're about to pass John McCain's home where he lives, and I'm sure it's late. I'm sure he's asleep, but maybe we can break in and see what's in his fridge." And I'm like, "Dude, I'm from Jersey. I love this. Breaking into John McCain's house, and I won't have to worry about getting arrested." I said, "I'm all in." And so we went in, and as soon as we rounded the kitchen, I looked through the kitchen, and John McCain was sitting there with another elderly, tough-looking man on the couch, engaged in conversation. So I didn't get my joy of breaking into John McCain's house, but I walk in, and he is sitting there with a former secretary, if I remember correctly, of the Navy. And they're like, "Booker, sit down. I haven't eaten." He goes, So I'm sitting there eating peanut butter and like celery or whatever. And these two men are talking about government inefficiency. And they say the place that we could be saving the most money, former secretary, if I remember correctly, of the Navy, and one of the great men on national security, they started detailing the waste in the military. They both claimed that we could have much more capacity, greater military effectiveness for billions and billions and billions of dollars less. I'll never forget. Again, this is me new to the Senate. I don't know foreign policy like I do 12 years later, or the military like I do 12 years later, but I was listening to these two experienced men complaining about the gross waste that was undermining our overall effectiveness and efficiency. And that's why, to this day, I'm infuriated that when people come in and say they want to cut budgets, the first thing they want to go for is not to take a real, because the military hasn't passed an audit in years, to have a real conversation about a lot of the baked-in corruption and misspending in the military, but they're going after programs that hospital after hospital, healthcare provider after healthcare provider, leader after leader, governor after governor says, are you crazy? And so this is one of the more preposterous moments that you and I both know if John McCain was here right now, he would reject this whole thing because we were literally repeating the same thing we did in 2017, 8 years ago. I will yield for a question while retaining the floor.
Isn't it true, when McCain talked about waste in the military, he studied it, he documented it, he said this is a good thing, this is a bad thing. He helped guide me on many of these things. I voted for some weapon system, getting some people upset because he showed me they worked, and I voted against a lot of them because he showed me they didn't. But isn't it so that our colleagues on the other side, when they talk about waste in the healthcare system, they don't document a thing? They use just a meat axe or a chainsaw, as Elon Musk perversely but proudly said he's going to carry one. And they don't document waste that they say exists, and then they just slash things that people need that's not waste at all, that's life support for people. Isn't that A
Yes,
huge
sir.
difference between the way McCain looked at waste, whether it's in the military or anything else, and what we're hearing here today.
Resoundingly, yes. I'm just laughing that every time Doge puts up their supposed savings, they then try to take them down because as soon as they're fact-checked, so many of them are not done. And I'm not saying all of them. I don't want to paint with a broad brush. I know having Microsoft licenses too many, yeah, there's waste. I wish we were doing this in a bipartisan way. Those cuts would be bigger and probably have a lot more staying power than what they're doing, which is ready, fire, aim, and then having to beg people to come back to work because they fired FAA people or nuclear regulators or what have you. But this is the bigger point that you're making that really is getting me. So you know this, I used to be an executive. There's nobody in this body. Here's a bold and braggadocious thing to say, but fact-check me, anybody. There's nobody in this body that was a governor, a county executive like Coons, or a mayor that cut government as much as I did. I had to cut my government by 25%. Imagine that here on the federal level. And I had to do it because I can't print money. It was a national recession. I was left with a mess, had to do it. But we found ways to do it cooperatively with a legislator, bringing in experts. But this is the point I want to make to you. One thing I couldn't cut was my healthcare costs. And so I started asking people, what can I do? And you know who I found? I found a big business owner who had tens of thousands of employees who said, I had the same problem. And you know what I did? I went into my cafeteria where thousands of people eat, big place, and I saw deep fryers and like Cinnabon-like products and all this unhealthy stuff. And I ripped it all out, had the union ready to go crazy on me, but then I brought in the best shelves. I paid extra money to get the best kind of all healthy, nutritious, whole foods, and then they loved it. And then they started asking me, can we get food to take home for our kids? Because we stopped through McDonald's or Burger King on the way home. Long story short, he said, it began to bend their cost curve. What do we do in the United States of America? What is Donald Trump, I just read, all thing doing? He's cutting access to healthy lunch programs. They're threatening to cut SNAP programs. They're threatening to cut the things that would give our residents in America, not the cheap, hyper-processed, empty nutrition foods, but the stuff that is healthy for our kids. So there's so much hypocrisy based in this that even the private sector folks are saying, you are going to drive up costs for your country when you make people get their health care in emergency rooms. You're going to drive up costs for your country when you're going to force people to have to quit their jobs so they can come home and take care of their loved one with dementia. This will drive up costs ultimately for our country, put more hardship on people, all while giving the most wealthy people who don't need it bigger tax cuts. It makes no sense, and that is the spirit of why John McCain voted against this effort in 2017.
I thank the gentleman. It's a hope, maybe forlorn, that maybe one of John McCain's words will influence a few folks over there before we proceed disastrously. I wish the gentleman strength and yield the floor to him.
I appreciate you allowing me to yield to you to answer a question while retaining the floor. I'm going to continue with a little bit more here before we change topics for the night. I want to point out how grateful I am for my friend Chris